it's always baffled me, folks. I can't understand it myself. I mean, we've been debating this thing since 1912. We've had presidents since 1945 proposing it. We're still sitting here, and it's getting worse and worse and worse. 47 million uninsured people now. Yeah.
But are we the only country where health care or health insurance is tied to employers and employment?
No, there are many, many countries where with employer-based system. Germany is one, Japan's another, Korea's another. In fact, the German system looks probably more like ours than any of the other national systems. In Germany, they have about 400, they call them sickness funds. It's basically 400 Blue Cross Blue Shields. It's a so-called multi-payer system. It's not single-payer. You do get your coverage largely through your place of employment, if you're employed. And they get excellent health care. There are no waiting lines. With very good health outcomes. You can even go to the spa for 3 weeks if the doctor recommends it. Zero. Under your health plan. And they're paying approximately 1/2 what we pay in the United States. That's something. That's something. But of course, all these countries, folks, control prices. They do not indulge themselves in the notion that, at least in this area, the market works. It doesn't. It doesn't. Never has, never will, and, you know, for good reason. For good reason. But, no, there are employer-based systems. And in a sense, I mean, Medicare is an employer-based, but employers and employees have to contribute, right? 1.45% on both sides of the Medicare Trust Fund. So you can, I mean, the Nixon plan would have worked. Unfortunately, sorry to say, if Ted Kennedy were here, he'd tell you this. The worst political mistake he ever made was not moving to support the Nixon plan right away. He didn't. He, Labor, the liberals opposed it because they wanted the Truman plan. They wanted universal Medicare. And this would have used the insurance system. 2 years later, he decided it was time to maybe sit down with the then president. He did, and then Watergate hit, and that was the end of the story. Had we come together in 1971 around something like the Nixon plan, we'd have universal coverage. And of course, you all know what happened to my bill. I mean, we started implementing it. I left. Bill Weld arrived, smart guy, but he never understood the health care system. Never understood the health care system. Kept saying this thing was anti-business. Nothing is more anti-business than the present system, I'll tell you. Everything he couldn't screw it up, and unfortunately delayed, and finally it went out the window, so there we are.